In Plus subscription, you will get daily live classes, not only recorded, but you will get live classes and a lot of structured courses. And there will be a lot of live tests and quizzes going on and unlimited access. So this is like a subscription of like Netflix. If you subscribe to Netflix, you can see all serials and all. Similarly, if you subscribe to Unacademy, you all the courses, batch course, test series, all will be available to you. And this is a new add-on with this Unacademy, and iconic subscription is there, in which you can get the best of Unacademy plus best of Prep Ladder. And this is all the specialty of Unacademy. And this is how it will look in mobile after you download your Unacademy app. And if you use the code Physio10, you will get 10% discount on this. Okay, so starting with the first class, and that is regulation of blood pressure. As I told you, these lectures are designed mainly for MBBS first year student and their professional examination. So those topics will be covered, which are generally asked in your professional examination. Of course, this will be important for your NEET PG as well. But how to write the structured question, the framing of question, and what examiner expect from you. So for example, blood pressure. Suppose if they ask what is blood pressure and how it is regulated. Or in the Viva also, they will ask you what is BP, what is blood pressure. So what you will answer? So everyone knows that this is the lateral pressure exerted by column of blood on the wall of artery. It is not a direct force, it is a lateral force. It is a lateral pressure exerted by column of blood on the wall of artery. So first point to remember here is that it is lateral pressure. Exerted by column of blood on the walls of artery. Okay, so this is the basic definition. Yes, good evening Oras, good evening Nitish, everyone good evening, hello everyone. Yes, it is lateral pressure, good Oras, exerted by column. So you know that in PG classes we keep on focusing mainly on MCQ and all the clinical things. In that we will talk basic things, how to measure blood pressure, what are the things, what are the cut-off sounds, what are the requirement so that you can get your BP measured correctly. So that examiner is asking in your MBBS examination. So that is BP, and you know that BP is systolic as well as diastolic, and the basic formula for that is cardiac output into total peripheral resistance. Cardiac output into total peripheral resistance. So cardiac output itself can be derived by multiplying stroke volume into heart rate. Okay, so can you tell me, Oras, Nitish, that cardiac output is responsible for mainly systolic BP or diastolic BP? It is mainly responsible for systolic blood pressure or diastolic pressure. See, systolic blood pressure is the maximum pressure during systole, and diastolic blood pressure is the minimum pressure during diastole. So one is systolic, other is diastolic. So one of the component is mainly responsible for systolic blood pressure and other is for diastolic. So among these two, which is going to be influencing your systolic BP? Cardiac output or yes, very good. So cardiac output is mainly influencing systolic blood pressure. Okay, yes, all is good. And TPR is responsible for diastolic blood pressure. So diastolic blood pressure means that your heart is in diastole. So of course aortic valve will be closed. So whatever be the peripheral resistance, that will be creating pressure during diastole, and that is called as diastolic blood pressure. Okay, that is why total peripheral resistance is the marker for diastolic blood pressure, and cardiac output, or indirectly you can say stroke volume and heart rate, is influencing your systolic blood pressure. And stroke volume itself depend on three factors. What are these three factors on which stroke volume depends? Stroke volume itself depend on three factors. What are these three factors? Yes, good evening Preeti Singh. Yes, what are these three factors on which stroke volume depends upon? Anyone? Okay, let me tell you. One is preload. Other is afterload. And third is contractility. Yes, Nitish, you are absolutely correct. Third is contractility. So, as told by Nitish Kumar, it is of course a marker is end diastolic volume, or end diastolic volume is representing preload. So, volume of blood which is after diastole, okay, or you can say before the contraction, is preload. And what is afterload? On what factor afterload depends? Yes, Ravarma. Afterload depends on which factor? Which factor is the most important determinant of afterload? By which factor you can determine the afterload? What is that factor? Anyone amongst all of you? It is mean. Yes, very good. It is mean arterial pressure. It's mean arterial pressure. I will discuss in detail. It is mean arterial pressure and contractility. So suppose that if you are decreasing the heart rate, examiner will ask you that if you decrease heart rate, you are mainly affecting systolic blood pressure or diastolic blood pressure. Because if by decreasing the heart rate you are influencing cardiac output, so you are mainly influencing systolic BP. And if someone is giving arteriolodilator by decreasing TPR, so that will be influencing your diastolic blood pressure. So this is the main formula by which you can tell a lot about blood pressure and all. Now after that, let me tell you two component. One is mean arterial pressure. What is mean arterial pressure? Because if they are asking you about blood pressure, you have to write everything. What is BP? What is the formula? And what are these two type of blood pressure? Mean arterial pressure, number one component. And second component is what is mean systemic pressure? What is mean arterial pressure and what is mean systemic pressure? Anyone can tell me the difference between these two? First, let me ask you about the concept. Conceptually, how they are different. And number two, what is the definition wise difference? Conceptually, what is difference between mean arterial pressure and mean systemic pressure? Concept wise. Pulse pressure plus diastole upon third. No, diastole plus 1/3 of pulse pressure. Okay, let me tell you first concept. For example, if this is your heart. If this is your heart, and the pressure by which blood is coming from the heart to the systemic circulation, what is that called as? The pressure by which blood is coming, yes, the pressure by which blood is coming in the systemic circulation, what is that called as? Mean arterial pressure or mean systemic pressure? That is called as, let me use some other color also. That is called as mean arterial pressure. So the pressure by which your heart is pumping blood in the systemic circulation, or the pressure in the aorta, is called as mean arterial pressure. And the pressure by which systemic blood is going back to the heart, what is that called as? and the pressure by which your blood is going back to the heart, what is that called as? That is called as mean systemic pressure. So there is a lot of difference between mean arterial and mean systemic pressure. So the average pressure in the aorta is actually MAP, and the pressure by which blood is going rolling back in the heart is called as mean systemic pressure. So this is MAP and this is your MSP. Now there was a question in the examination that hypothetically, if you stop the heart, whatever pressure is present in your heart, what is that called as? MAP or MSP? If you stop the heart, although hypothetically, so hypothetically, if you stop the heart, what pressure will be present in the circulation? MAP or MSP? Yes, Mridul Tripathi? That is MSP. Very good. So hypothetically, so this is also definition of MSP, that hypothetically, if you stop the heart, hypothetically, if you stop heart, pressure present in the circulation is mean systemic pressure. So this is the actual definition. This is the actual definition, because if you stop the heart, what will be MAP? If you stop the heart, MAP will be 0, isn't it? If there is no, heart is not circulating, whatever be the pressure coming from the heart to the circulation will be 0. So whatever pressure remain, that is called as mean systemic pressure. Okay. So this is the difference between mean arterial pressure and mean systemic pressure. So as told by Nitish Kumar, that mean arterial pressure is the average pressure in the aorta. So as told by Nitish Kumar, that mean arterial pressure, it is the average pressure of the aorta. It is the average pressure This is the actual definition. But if this is the average pressure in the aorta, why you don't say it is diastole plus systole upon 2? If that is the average pressure in the aorta, why don't you say that it is diastole plus systole upon 2? Yes, always Nitish, Akshay, Sarthak, Ravarma, Priyanshu, Ghost, Mridul Tripathi. Why you don't say if it is average? Average means A plus 2, A plus B upon 2. So why it is not systole plus diastole upon 2? What is the implication of that? Why you say that formula should be diastolic blood pressure plus 1/3 of systolic blood pressure minus diastolic blood pressure. A pressure present throughout the cardiac cycle. Yes, because answer this is question of your YY in your MBBS. Answer is that because systole and diastole are unequal. Approximately it is only covering 1/3 of the cycle and it is covering 2/3 of the cycle. Okay. So the pressure which is always present, that is diastolic BP plus 1/3 of systole minus diastole. Or you can also say, you can calculate like that, diastolic blood pressure plus 1/3 of systole pressure minus diastole pressure is also called as, it is also called as pulse pressure. It's also called as pulse pressure. Pulse pressure means systole minus diastole. It is called as systole minus diastole. After that, they can ask you that what is the actual and the best method of recording of BP? What should be the prerequisite for recording of your blood pressure? Recently there was hypertension day, I think, World Hypertension Day. So they give us a lot of guidelines to measure blood pressure and all. Yes. So what are the I mean, if they ask you in Viva or in the examination, because nowadays in AIIMS examination they are asking a lot of question like that, because it is believed that most of the doctors don't know actually how to measure BP. Number one is that patient should be in seated position. It can lying down also, but if patient is seated, not standing, I mean, and that will be after at least minimum of 5 minute rest. Otherwise, you will get high BP. So the first requirement to measure blood pressure is that patient should be seated position. Yes, in brachial artery also. Yes, so you can write second part is it should be accessed where? In which artery? Brachial artery. Yes, you are correct, Akshay, with that. Number three, arm should be at the level of heart or up or down. What should be the if you are standing and patient is sitting, okay, you will take arm upside like that and you will measure BP. But that will be something low or high. It will be false. I have discussed that point in clinical MCQ. Yes, so arm should be at the level of heart. I will not go very deep because I will first of all I will clear basic, because this channel is dedicated mainly for MBBS students. Okay, so that we can clear basic here, and in the NEET PG section of Unacademy we will discuss clinical question. Okay, because in professional examination they are asking question like that. Arm should be at the level of the heart. Okay, number four, what should be the length of BP cuff? Levorocki cuff. Yes, length of BP cuff should be how much? If you've seen sphygmomanometer, I'm not having here. In clinic, I can show you have seen that. So, what is the length of the cuff which is inside the, I mean, whatever you're bending? This is your Levorocki cuff. So, what should be the length and what should be the breadth? Otherwise, your BP will not be accurate. If patient is obese, you have to measure with other cuff. If patient is lean and thin, then that should be other cuff. Yes, 80% of arm circumference. 80% of arm circumference. Good. And what should be the width? That should be 40%. It was asked in the AIIMS also in one of the examination. Okay, and it should be inflated at least 30 mm Hg above the expected. Suppose you are expecting 150, so you should go up to 180. So it should be inflated up to 30 mm Hg above expected. See, these classes will keep on going and we will try to cover your 5-year, 10-year, previous year paper. So I will try to discuss all those questions which has been asked in your university examination. So I will try to discuss in that manner. I will take question in some sequence wise and we will keep on discussing these questions, your 5-year, 10-year question, whatever it be, and you can also post your doubts or any question you want like that. Okay, and the rate of deflation. What should be the rate of deflation? It should be deflated not more than 2 to 3 mm Hg per second. Should not go very fast, otherwise reading will not be correct. So these are the 7 criteria by JNC, Joint National Committee for Hypertension, that minimum you have to obey that, then only BP will be correct. But the best thing is that it should be measured at home, because in clinic you will get a bit high reading. Now after that, what are Korthoff sound? Today and tomorrow, half an hour session, we will discuss BP, and after that we will see what you want. So what are Korthoff sound? During measurement of blood pressure, you will get a lot of sound, and these sounds, because of increased turbulence, you will get sound, and those sounds are called as Korthoff sound. You are welcome, Horus. because exams are very near, only few months are left, so I will try to discuss 5 year, 10 year, whatever question they have asked in your examination. Okay, so phase 1, phase 2, phase 3, phase 4 and phase 5. So what about phase 1? Suppose if you keep on deflating, suddenly you will get a tuck 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 tuck, isn't it? That is called as clear tapping sound. So the first sound after inflating to the higher level, you will get a clear tapping sound. And which blood pressure is that? As soon as you get some sound, very clear sound, when first sound appear, when expected cuff-off pressure at the level of 182 or less than 120 mmHg, the first sound appear in systolic BP. Yes, the first sound appear in the measurement of BP is called as systolic blood pressure. Okay, and after that tuck 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 tuck, you will get a murmurish sound. That is not murmur. Don't say that cough sounds are murmur. No, these are physiological sound. They are not murmur. Murmur are abnormal, but you will get murmurish sound. That is called as murmurish, ocean-like, as if sound of oceanic water. And then third, you will get a crisp sound. First tapping, tuck 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 tuck, that is systolic BP, and then murmur sound, and then crisp sound. And fourth, after that, fourth will be what? Fourth will be muffled. What is muffling sound? What is muffling of sound? Yes, Nitish, Akshay, Oras, Priyanshu. Muffling, you know muffler man. I will not say that. I mean, if you put a muffler on the front of your mouth and if you speak, sound will be muffled, isn't it? So just put a muffler and you will speak, your sound will be muffled. That is called as muffling sound. Okay. And after muffling, slowing down of the intensity of the sound, this will disappear, and that is actually your diastolic blood pressure. So muffling of sound is not diastolic. When sound disappear, pressure at that point is called as diastolic blood pressure. Yes, dumb sound. Okay. So after that, after a short discussion of BP, I will keep on discussing more. We can discuss regulation of your blood pressure. Yes, no sound due to laminar flow. Absolutely correct, Nitish. So you know there are mainly two methods of regulation of BP. One is short-term control, other is intermediate, and third is long-term. Long-term regulation of BP, and there is intermediate also. You can write down some points which are important in your professional examination and very important for NEET PG also. But if your basics are clear, MCQ solving ability will be enhanced. Okay. So anyway, short regulation of BP, you remember we have discussed in that section. There are mainly three. One is baroreceptor. This can also come as a short note. What are baroreceptors or baroreflex? What are baroreceptors or baroreflex? Short-term measurement, there are two types of baroreceptor although. Second is chemoreceptor or chemoreflex. They are common in respiratory also. And third, well known and repeatedly asked in your MBBS examination as a short note also. It can come as a separate question. CNS ischemic reflex or response. CNS ischemic reflex or response. Okay, long term is RAS, and I will discuss intermediate after a short while. Long term is RAS, renin, angiotensin, aldosterone system. Okay, so let me start today and continue tomorrow because only 5 minutes are left. So just tell me what are the two important baroreceptors in your body? What are the two important baroreceptors in your body? What are these two? B is not for B. B is not body. Remember, don't say carotid body and aortic body. Body are chemical. So they are sinus. They are carotid sinus and what else? Aortic sinus. And both these are responding. They both respond to which mean arterial pressure? What is the range of this response? They both respond to which mean arterial pressure? Yes, Sarthak. Both of them respond to, see, what is the normal MAP? If you measure, you will get around 93. So you can say 90 to 100. This is the normal range of your mean arterial pressure. But if your BP comes down to 60 or come up to 180 mm of Hg, they will act and they will control your blood pressure. So they will respond to mean arterial pressure of 60 to 180 mm of Hg. So either your BP fell down or it will go up. In both cases, these will fire and they will control your BP. Now, question number 2. They fire when BP is more, they fire when BP is less, or they fire always? I am asking about carotid sinus and aortic sinus. So they are firing when BP is more or BP is less, or they are firing always? What do you think about this? Yes, they are tonically firing. This point is very important, and if you remember, this is very good. They are tonically firing. Very good. ऐसा नहीं होता है कि बीपी कम हो गया तो फायरिंग बढ़ गई बीपी को बढ़ाने के लिए, ऐसा नहीं है. ये हरदम फायर करते रहते हैं. दे आर टोनिकली फायरिंग. हरदम ये फायर होते रहते हैं. ओके. अगर बीपी ज़्यादा होगा तो ज़्यादा फायरिंग होगी, बीपी कम तो फायरिंग लेस. सो ऐसा नहीं बीपी कम तो फायरिंग मोर. Don't put negative feedback mechanism like that. See, they are always firing. They are firing always. Yes, they are firing always. Point number one. Point number one. And let me take one situation. Suppose this is your carotid sinus and blood is going like that. Blood is going like that. What is the afferent of this sinus? As everyone knows, ninth nerve and 10th nerve. These are called as buffer nerve. These are also called as buffer nerve. Okay. Suppose that if in your body BP increases, okay, what do you think? Stretch will increase or decrease? If BP increases in your body, stretch will increase. And if stretch will increase, firing will increase or decrease? Firing will also increase. Please note that point. This is very important. Number one, they are tonically firing. They are firing always. Number two, if there is more blood pressure, stretch will be more, firing will be more. And this will send signal to which portion of the brain? That is medulla oblongata. Okay. In medulla oblongata, there is nucleus tractus solitarius. You might be knowing about that. Now, BP is more in your body. So you want to decrease BP or increase BP? Your purpose is to increase blood pressure or your purpose is to decrease blood pressure? What is your main purpose? Purpose is to increase BP. BP is increased. So you have to decrease blood pressure. So they are acting mainly on two centers. One is called as vasomotor center. One is called as vasomotor center and other is called as cardio inhibitory center. cardio inhibitory center. So of course you know that purpose of vasomotor center is to cause vasoconstriction, and vasoconstriction will increase BP and you want to decrease BP. So you have to inhibit vasomotor center, and because you have to decrease BP, so this is cardio inhibitory center or your vagus nerve. So you want to decrease the heart rate so that you can decrease BP. So that will be inhibited. Sorry, that will be excited. So vagus nerve will be excited so that this can decrease BP, and ultimately what will be the end result? What will be the end result of that? End result will be BP will be decreased. Your blood pressure will be decreased, isn't it? Now, one thing I want to share with you that is very important. There are two centers of the vasomotor. One is called as CVLM, other is called as RVLM. One is called as CVLM, caudal ventrolateral medulla, and rostral ventrolateral medulla. Okay, so if you want to decrease BP, what you will do to that center of the VMC? CVLM and RVLM. This is called as caudal ventrolateral medulla. And this is called as rostral. जो ऊपर है वो रोस्ट्रल है, जो नीचे है वो कॉडल. कॉडल मतलब पूंछ, टेल. Rostral ventrolateral medulla. This is the ventrolateral medulla. This is rostral and this is caudal. Caudal means tail. Okay. So normally or physiologically, which portion is increasing your BP and which portion is decreasing your BP? What do you think? See, जब आप घर पे आते हो और कुत्ता पूंछ हिलाता है, अगर आपके पास पेट है, in that case BP कम हो जाता है कि बढ़ जाता है? If dog is wagging its tail, your BP comes down or increases? Decreases, isn't it? So remember, caudal means poonch, tail. So this will decrease BP normally. And rostral, sir. So आपके सर पे गुस्सा रहता है. So that is increasing BP. Normally. So always remember, CVLM is there to decrease BP and RVLM is there to increase BP. And you want to decrease BP. So how your VMC is acting? Which will be inhibited and which will be excited? Which will be inhibited, CVLM or RVLM? In that particular case, if your BP is high and you want to inhibit decrease BP, in that case, which center will be excited? Because normally caudal is decreasing BP. Yes, or else Akshay, Nitish, Ravarma, Priyanshu. What do you think which center will be excited? If you want to decrease your blood pressure, बहुत आसान है, it's very easy. Yes, Ravarma, CVLM excited. It's wonderful, very good. CVLM is excited because it is normally decreasing the BP. Okay, and what about RVLM? RVLM will be inhibited. So this is how the first scenario we have discussed about when BP is more. There are so many scenarios I will discuss tomorrow, but this is the first scenario. See, I request everyone to subscribe to this channel, Unacademy NEET PG, and this is for first year only, pre-clinicals. And anatomy, physiology, biochemistry lectures will be, this is the first lecture of this channel. This is the first lecture which you are attending. Very soon this will be a hit with the MBBS student, because there is nothing like in the internet where MBBS, at the level of MBBS is discussed. All channels are dedicated to mainly either NEET PG or some other competitive examination. But here we will try to, yes, I will discuss ligature of the proximal, distal, BP will increase, but I will take only half an hour session per day, so that you should not get bored also. And tomorrow will be discussing about BP is less, ligatures about the massage and all those things. Okay, so you can subscribe to this channel, and anatomy, physiology, biochemistry lectures will be there, so especially designed for first year student. And whatever topic you want me to cover in your 10-year paper, whatever stuff you are feeling like that, long question, short question, viva question, practical question, all we will be going to discuss here. Even practicals, if you are not able to measure RBC and all, that we can also discuss here. 2 times in a day. Okay, of course there will be not 2, there will be 3 or 4 times a day, but not only physiology. Sometimes you will get anatomy, sometimes you will get biochemistry. Okay, so this is a new initiative by Unacademy, and this is really wonderful because this is a lot of demand, because we used to discuss only MCQ in that section, and here we keep on discussing MBBS. So thanks, like this video and subscribe to this channel, and please share this with all your MBBS colleagues, so that everyone can join and we can discuss more, because if more students are there, we can be more enthusiastically, isn't it? So thanks, good night, all the best, and very soon we are going to cover all the 10-year paper before your first year examination. So thank you, good night, Oras, Ravarma, Akshay, everyone, thanks.